So first of all, Dr. Dinas, thank you very much for your kind introduction. And it's a great pleasure to be here in Cairo at this big event where we also have a chance to speak about the child-adolescent mental health and child-adolescent mental health services. My name, as already Dr. Dina said, is Nobert Skoukauskas, and I am a professor at the largest university in Norway called NTNU. And for a number of years, I have been the chair of the WPA Child Adolescent Psychiatry section. And if you are not a member of our section, I invite you to join it. It's not so easy to do it. If you just go on to Google and Google WPA Child Adolescent Psychiatry section, you will get the form to fill in. And we have your colleagues from all over around the world, and we share information and do other things which I also would like to highlight before I speak more specifically about the enhancing child-adolescent mental health services. So the section, it unites child psychiatrists, medical doctors who are specialized in child psychiatry around the globe. And together we set the vision for our specialty's future. Just recently, we have published, together with other associations, including the YACAPAT, Daniel Funk, the president of YACAPAT, is also here, highlighting the new reality where we're facing global economical crisis, we're facing wars even in the places like Europe, and this, of course, affecting the children's well-being and mental well-being, and cannot be left without attention. We also standing for the child psychiatry within the World Psychiatric Association, but also outside it. And we have our own journal, World Child Adolescent Psychiatry, which is actually also has reported once the station about the child psychiatry in Egypt. And we also provide the training for the junior colleagues who are just starting their career into child psychiatry. We, together with Dr. Khalid, we had several courses before the COVID in the Jeddah, and I believe people from Egypt also came to those courses. We also have some courses in Europe, and then including Italy, where Professor Bennett Leveltar, the former chair of the WPA Child Psychiatry, ran those courses for a number of years. And we as a section also engage in the number of the multinational research project. I will bring one project to your attention a little bit later, where also we have some data and participants from Egypt. And we provide a platform for the major conferences, because if for example, if we Europeans or people from North Africa, psychiatrists who want to present at a large conference, for example, at the American Academy of Child Psychiatry, for us might be more difficult or challenging to compete individually, but when we come together and provide the international perspective on OCD, ADHD, or other disorder, usually American psychiatry is welcoming us. So now I move to another part of my presentation and talking about enhancing child-adolescent mental health services. Before going to specifics, I want to just remind you, why do we need this? I'm sure all of us know that the mental disorders are very common among children and adolescents. In fact, according to some resources, some research says that even up to 1 out of 3 children at some point in their life would develop mental health disorders. Mental health disorders not only common, they cause massive disabilities and affects the quality of life, not only for the children, but of course for the family. And more recently, the pressure on camps has increased. This is just some data from Norway. You know, Norway is a well-resourced country. We have big child adolescent psychiatry services, comparison even to other European countries. In fact, in Scandinavia, I believe Norway and Finland, we have one of the highest rates of the child psychiatrists per person. But even our services in the recent years are under the pressure. So in 2021, altogether 65 children and adolescents received services from the Norwegian child adolescent psychiatry or mental health services. And this is 14% increase over the prior year. So, usually we get 1 year more, 1 year less, but 14, we have never had such an increase. And we were also thinking why we have more kids coming to the services. And this could be contributed to the COVID-19 pandemic. And then also stress related to bullying, perhaps social media, climate change and global instability, and of course economical pressure on families, even in the well-resourced countries. And Norway is not unique in that way. The other country, which is well-developed, United States of America, they announced a national emergency in the mental health for children just in 2020. And they also noticed that pandemic intensified the crisis across the country, and they especially witnessed in emergency increase in the visits to A&E emergency departments, including suspected suicide attempts. Some similar happening in the other English-speaking countries like Ireland, where I was trained as a child psychiatrist some years ago and worked as the consultant child psychiatrist at the oldest pediatric hospital in Dublin. And they also noticed, my colleagues there, that the presentations for acute referrals have increasing in Ireland as well. And similar in UK, we can see the 30% increase on referrals in comparison to the past year and 60 to the 2017. I don't have data from Egypt, but perhaps one of the colleagues will tell me when we have a chance to discuss. But I'm sure that Egypt is not unique. I think in every country, we as a child psychiatrist feeling that the services are getting more and more pressure to accept more referrals and see more kids. Another thing which I'm not going to go into very deep into detail is, but we all know the diagnostic criteria for some disorders have changed, and that also affects our capacities. For example, the gaming disorder, which previously was not officially recognized, now in the new ICD-11, it's already a formal mental health disorder. Even the PTSD, post-traumatic stress disorder, there are changes in the ICD-11 made by the World Health Organizations, which allowing easier diagnosis for post-traumatic stress disorder. And also, we also know that the families these days are becoming, with every year, with every month, becoming more and more educated. So some years ago, the doctor or the mental health professional, we had the monopoly of knowledge, and the families who came to us knew very little about their children's problems. But with every year, families are more educated, and even before they come to see a doctor and child psychiatrists already have done their research on the Google. And sometimes one of my close colleagues says that those some parents even have a PhD in Google because they Googled all the possible disorders. And it means that we are no longer monopolist have monopoly of the knowledge, and we are more knowledge facilitator, that we have to make sure that when the parents get the information from internet, that they get from the well-approved sources, that they get information which is evidence-based. So, as I already mentioned, just to summarize, so mental disorders in children are common and disabling. There is an increase in referrals to child and mental health services. There is classification changes which allow some diagnoses to be diagnosed easier, and there are some new diagnoses like gaming disorders which were introduced. In some cases, we have better assessment tools, so we can diagnose disorders more quicker. And there's also increased participation by families. Also, in some countries, in UK, especially also in Scandinavia, we are trying to create so-called green camps, because we see kids who are coming with the new worries, which, let's say, even 5 or 6 years we didn't have. So the kids who are worried about the global warming, the change of the planet, and they get very, very anxious about that. So we need, so to speak, also be green and understand how to respond to these new worries. At the same time, as you also know, there is a shortage in mental health service providers and also financial resources in child adolescent mental health services. This data is from the WHO, World Health Organization, and World Health Organization does the assessment of the human capacity, and these 6 regions of the WHO, and as you can see, only the European region and the American region, they have more than 0.1 child adolescent psychiatrists per 100,000, and this is coming from 2020. Our WPA Child Adolescent Psychiatry section some years ago established 3 consortiums, and one of them actually focused on the academic child psychiatry in the Middle East. And we have several publications, and also we have 2 collaborators from Egypt. Maybe I will have a chance to meet them in person, because this paper, when we wrote it, was also pandemic, so it was hard to have meetings in person. But essentially, we assess the child psychiatry services, training and postgraduate training, gaps in distribution of specialists and other things in the Middle East as one of the WPA child psychiatry projects. And we got the data from all the countries in blue, except we didn't get the data in Yemen. So somebody said to me that there is no very well developed child psychiatry in Yemen. I don't know, but we didn't get any information from Yemen, but we got from the 15. And of course, Middle East region is the region which has a very young population. So Europe is aging, America, Canada is also aging, but this area is young. There are a lot of children and kids in comparison to other regions of the world, and it's very important they get the good mental health, and if they have problems, that those problems are addressed. So for the sake of the time, I'll just summarize the main findings. And the general psychiatrists which were available in the regions per country, they range from 10 to 3,082. And in fact, one of the highest number of psychiatrists were giving from Egypt, and also the general psychiatrists treating children, adolescents, but also the spread was very wide. And let me just move to the next slide, which is quite busy, but you can also see that the Egypt is on the first line. So as already mentioned, Egypt in the region, of course, it's a very large country, but had the high number of psychiatrists, and then many psychiatrists also treated children, adolescents. Despite that, there is a recognition of the child psychiatry as recognized and separate specialty. And this is just another map we summarize about the national guidelines for the child adolescent psychiatry training. So the countries in green, those are the countries which had in 2020 the training for national guidelines for the child psychiatry training. And on your right hand, you can see the map which says which countries, again in green, which had the national youth mental health policy. So not so many. Now this survey was done some years ago, so maybe the situation has changed. but I know that these things do not change so quickly. So the full paper has been published in the European Child Adolescent Psychiatry Journal. And this is also the last graph from that paper, which shows that, unfortunately, the countries which had fewer financial resources, they also also didn't have, for example, a national youth mental health policy and national guidance for the child adolescent psychiatry training. In fact, as you can see, that resources do play a role when it comes to the policy development. So how to engage in enhanced camps? How can we make our services stronger and better? And we need to look at the new ways to do this. And it comes to the word innovation. So and essentially doing more with the less resources. And it says any combination of activities or technologies that breaks existing performances. And this is just only one of definitions, and I'm sure you can find many more. But as I mentioned, in health is getting more for less, more value, better outcomes, greater convenience, and so far, so on. And in order to innovate, in order to change, especially in the child psychiatry, we need to have many, in fact, all stakeholders on board, including our colleagues in the services, patients, organization. We need some companies to develop innovative tools, and of course, regulation agencies. So World Economic Forum does many things, but one thing they also do, they have the council, Global Future Council on Mental Health. And I believe it was last year, they picked several topics which they think are promising in terms of innovating mental health. In fact, there are 10 of them, but for this presentation, I put in this slide the first 5. And as you can see, among other things, there is mental health curricula for schools, novel drug therapies for treatment-resistant depression, telehealth, digital hotlines, counseling using allied professionals, social media analytics, and also predictive analytics and big data. Now, I don't have time to go through all of these topics in details, but I just would like to share some examples, some experience, what we do in Norway, and also what we do as the WPA Child Adolescent Psychiatry on the global scale. So mental health curriculum for school, this is an idea which has been around for some time. In fact, just recently, my team, we received support from one of the European agencies to develop a new project which is called Empower 21. Essentially, it's introducing mental health curricula for university students. And this curricula will help students to recognize what is good mental health, how to keep healthy, and if you have a problem, where to seek help. In other words, also diminishing the stigma, which of course always is attached still, unfortunately, with mental health problems. In terms of the mobile apps and the digital hotlines, there are so many of them. Even if you go to the Google Play or the Apple system, the problem is that many of those tools, they are not validated. There's not enough evidence that they are working. And now, especially in Europe, European Commission introduces more strict regulation, because once it's just to have the tool on the system, but it's another thing is to provide rigorous testing and studies. So just to mention, one of my teams, we developed the ECBT for children with OCD. Essentially is the tool which incorporates not only the app which you can see, but also video sessions, psychoeducation, and essentially it helps children or the families to do, for example, exposure exercise. As you know, that the OCD, for example, if the child is anxious or cannot wash, is afraid of something and he's washing his hands all the time at home. So if he's afraid of germs, for example. And these things usually happens at home, but the therapy usually happens in the clinic. So with the help of our new developed OCD app, this can be done in where actually the problems occur at home. So in a way, in the old days when the clinician had a lot of time, he or she could spend with the patient a day or maybe more. But nowadays, because of the limited time, the patient comes one after another, the sessions are short, and this app actually helps to provide the therapy in the patient house. And we have the papers published which demonstrates feasibility, acceptability, effectiveness of this package. Just one thing to mention, that these innovations, where I had the list, they also mentioned that the care should be delegated to allied professionals. So child psychiatrists should focus on the most difficult cases, and the allied professionals shall provide the help, especially where resources are limited for milder cases. And WHO has developed some years ago tool for non-specialists to provide the services for children, and not only with mental health disorders. And we, as the WHO Child Psychiatry section, helped to adjust that MHGAP tool to introduce it even in the early stage of the training, where young clinicians are getting exposed to these materials when they are still in training, and then they can help provide the help which is needed. And the last thing on this list, which I also would like to mention, is using technology and big data to support decision-making in clinics. So one of the projects my team is doing is called IDEAS. Essentially, the full name is Individualized Digital Decision Assist System for the Diagnosis and Management of Mental Behavioral Disorders in Children and Adolescents. So because my university is, full name is essentially Technology University, Norwegian University of Science and Technology, which means we have a lot of people, a lot of specialists in technology who can help us to use the big data. I understand that most of the people here are clinicians, so I just briefly summarize this system, what this actually does. So for example, when I was a young doctor some years ago, and if I had a difficult case which I was not sure what to do, I would go and ask one of my senior colleagues, senior clinician, and will ask him, have you had this and this similar case, similar patient who presented with these and these complaints, and what did you do? And my senior colleague will think a little bit and say, yes, I had maybe 5 or 6 years ago, and I did this, and I diagnosed, and I did this medication and these therapies. But these days, when we have technology, we can actually use the big data. We can use if we have electronic health records, to support our decision rather than asking the old colleague. We can ask electronic records to support our decision based on the previous experiences. So if I just move to this slide, which summarizes our system. So essentially we have, if you can see in the green circle, in Norway, different health data systems which we can ask information about patients and which can inform us when we're making decision. And then we can also use the knowledge-based evidence, which here can be seen in in the red circle. And essentially both experience-based knowledge, so the old data and also the evidence which is coming from the research can help us to make a right decision. Because when we practice medicine, when we practice child psychiatry, it's very important that what we do is based on the, of course, evidence-based, but also on available resources, available training skills and experiences. This now it's a big project. We have altogether several institutions working on it, 3 PhD students. But what is more importantly, that when we started to use this old data, we also asked service user organizations. So we have a lot of parents organizations, also former child service users organizations about using old data to support decision making. And they were very positive. In fact, we even decided to make a study, and what, among other things, which we found out that most of the service users, despite mental health data being sensitive, but nowadays there are different procedures which can anonymize the data, they were positive and approved the storage and also the use the old data to support decision making in clinical practice. So on this slide, I would like to summarize my speech. I think we are living in the times when we are facing global crisis everywhere, the economy, the inflation, the wars, including wars in Europe, climate change, and these things also affecting our children's well-being, including mental well-being. We cannot ignore that. We can see that in all the countries, so in many countries, there are more children coming to child psychiatry clinics and services. There are greater demands and the pressure on our services. And in order to meet the new challenges of the new crisis and also to meet the pressure our services are facing, we need to innovate. We cannot just work the same as usual. We need to find innovative ways to address the challenges, and I believe that technology can be one of those ways. So thank you very much for your attention. Thank you.